Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to discuss Lyme disease, and we're going to discuss whatever you want to. We make these webinars are created by your questions, so I'm interested in seeing what you have in store. I see some familiar names back here again, and I see some new names as well too. So welcome to all of you. For those of you that are new, let me just kind of quickly describe how these webinars work. So there's a couple ways that you can participate. One is to write a question to me in the chat box, and there's a chat box down at the bottom. You have a few options there, but I would prefer that you actually write it as a chat and not use the Q&A only button down there. Okay, so just use the symbol that looks like two talking diagrams, not the one that looks like a question mark, basically. Okay. And then secondly, and then I'll respond if I have time to get to the questions. All right. So keep in mind with that. Usually there's more questions than I'm able to get to each week. I do not avoid any questions. I try to take as many as I can. Okay. All right. Second way that you can participate is to see what responses I give to questions people have. And if you're here on the live version, I do place those questions on your screen so you can see them. That function does not work in the recorded version, though, so I will read the questions out loud as well too. But if you're here live, you'll be able to participate by reading along with me if you want to do that as well. Okay. All right. So as usual, I am creating a recording of tonight's webinar. And if everything goes as planned, I will get that webinar out to you, the recording of the webinar out to you tomorrow morning, somewhere between 9 and 9:30 a.m. Central Standard Time here in Austin. Okay. And let's see. Also, when I send an email out to you, there'll be a chance to sign up for next week's webinar. We are doing another one next week. All right. And I think that kind of takes care of the business here. So why don't we go ahead and get started? I'll take the first question here. Hello, Tyler. Let's see. Hi, Dr. Ross. I have a positive InfectoLab elispot and also tested positive for elevated anti-dopamine receptor D1 antibodies on the Cunningham panel. If I understand correctly, these results put me in the fortunate position of having laboratory evidence of both an active infection and an autoimmune reaction. Given there is an overlap between neuropsychiatric and neuropathic symptoms caused by active infections and anti-neuronal antibodies, how would I know when to stop treatment for an active infection and to start advocating for immunomodulatory therapy, such as IVIG for autoimmunity? I see some doctors have had success with intramuscular penicillin in such a situation, but it is possible to resolve autoimmune merely from treating the infection with oral antibiotics or herbal antimicrobials. All right, so there's a lot to unpack in that question. So let me just try to cover a few things to begin with. So first of all, you mentioned that you have evidence of positive infection and also evidence of having autoimmune illness going on. So to clarify, the elevated anti-dopamine receptor D1 antibodies mean you have an autoimmune illness affecting your brain, okay? And then the reason you could say that you have an active infection is based upon what the meaning is of an elispot, right? So an elispot, what we do in an elispot test technique is we take a type of white blood cells from your blood called T cells, and we're looking to see if they react against proteins from the infection we're testing you for. Okay, so I assume in this case you meant Borrelia or Lyme InfectoLab elispot was positive. So we take your T cells, put them in a test tube. We take some proteins from Lyme germs, we stick them in the test tube, and then we see if your T white blood cells produce certain cytokines, inflammation chemicals called cytokines. And if they do, that means that those T cells have seen the germ in you. Now, T cells that we're measuring in these test tubes, or the reaction we're measuring in the test tubes, these T cells only have a lifespan of 2 months. All right, so once T cells are made and they circulate in your bloodstream, they only live for about 2 months. So if these T cells are reactive and making cytokines when we put the Borrelia proteins into your test tube, that means that they've seen Borrelia in you sometime in the last 2 months, which would suggest an active infection. Okay, all right. Now, one thing about the InfectaLab test is it probably still misses infection if you have it 15% of the time. So if you were to go back and retest in the future and it comes back negative, that does not prove your infection is gone. It just means it's not picking it up. All right. So I want to clarify that. We do not have a test that we can do that says whether it's an elispot, whether it's going back and repeating immunoblots, even if it's measuring the DNA of the germ in you, called a PCR. PCRs will often miss an infection if it's there too. So there is no test that if it comes back negative that proves that the germ is out of you. Okay, so that's where the dilemma comes in. So generally, what you're proposing here is use antibiotics to kill the germ. And if that doesn't work, then maybe treating for the autoimmune illness with IVIG, which is intravenous immunoglobulins. And we do use intravenous immunoglobulins for autoimmune illness. Okay, all right. So, but here's what the difficulty is, and I think you know this, is it's very possible that it is Borrelia that is triggering the autoimmune reaction that you're having. And that if you get the Borrelia under control, the autoimmune reaction should go away. All right. So now, when somebody has Borrelia, rarely do they have just neurologic manifestations. All right. So in addition to having some of the confusion you might get, sometimes people with Borrelia often will have fatigue. They're often going to have joint pains. They're going to have disturbed sleep. They're going to have a whole host of other symptoms. So one thing that you could do is, as you're treating with antibiotics, is follow the other symptoms that suggest Lyme being present. And if you get to a point that those other symptoms are gone, and primarily it's just the neurologic manifestations that remain, then it might be time to start thinking about doing an IVIG. Okay, that's one thing. The other thing that you might consider doing while you're using your antibiotics before you even think about doing IVIG is to work to try to regulate the immune system so that it is not as reactive. It's not having autoimmune. It's not attacking you, okay? And one of the things that you can do to modulate the immune system so it is to turn down that autoimmune reaction is to work with something called naltrexone, or we call it low-dose naltrexone, the way that we use it, all right? So naltrexone, everyone, is a narcotic blocker. And we have our own natural narcotic system in our body, which are called endorphins, or we have endorphin receptors. And if you provide a blockade of endorphin receptors, a temporary blockade, say of about 4 to 6 hours, which is what low-dose naltrexone does, you get a regulation of the immune system, so it tends to be less autoimmune. It tends to have a lot less what I would call a Th2 reactivity versus Th1, okay? And also by doing that, you actually make it so that the Th1 side, which is the part of the immune system that actually attacks germs, will actually have better chance of attacking the germ too. It turns that on. You create balance, okay? So one thing you might want to consider doing in addition to the antibiotics, talk to your doctors about it, is possibly starting low-dose naltrexone to try to make it so you are in more imbalance between what's called Th1 and Th2. Overactive Th2 is what we often see in autoimmune illness. You can kind of turn that down, which will allow better functioning of Th1, which is the part of the immune system that helps fight infections. All right. And the way you would do that, I'd start people usually at 1.5 milligrams a day. And then I have them increase the daily dose every 2 weeks by 1.5 milligrams a day, trying to work up to 4.5 milligrams a day. I have people take it in the morning so that it does not disturb sleep, because rarely it can disturb sleep, especially if you take it at nighttime. Okay. All right. So that's something to think about talking with your provider about. In terms of the penicillin, I'm not sure why people are using penicillin for this. So I'm not sure where you've seen that. I can't comment about what they're doing. I mean, penicillin would not do anything to treat it would treat possibly spirochete Lyme, but it may not be effective against what's known as intracellular Lyme or even what's known as the cyst form of Lyme. Those are the appearances of Lyme. All right. So Lyme has 3 different states that it looks like. All right. There's spirochete, looks like a corkscrew. There is a form that lives inside of cells. We call that the L form, or intracellular Lyme. And then there is a cystic form. Now, these forms also have growth states. They can either be growing or they can be hibernating. We call those persisters if they're hibernating, okay? But the penicillin's only going to be good for the spirochete. So I'm not sure in what capacity you've seen it used for the autoimmune illness here, okay? All right. I think, yeah. So the answer is follow your other symptoms and see if they give you a clue as to whether you're done, okay? All right. Good luck to you, Tyler. Hello, John. Hi, Dr. Ross. I'm going to be trying your Tier 1 Bartonella protocol with azithromycin and fluconazole. I can't tolerate cinnamon and clove, so I hope it's okay to substitute Japanese knotweed, as you mentioned in the herbal section. I take my other supplements, multivitamin, magnesium, zinc, D3, K2, curcumin, and molybdenum with breakfast, planning to add the JKW, Japanese knotweed. I was trying to think, what's JKW? JKW with breakfast and dinner, the fluconazole azithromycin with lunch, and probiotics before bedtime. Would you recommend any changes to that schedule? Should I jump right in at full doses or ramp up slowly? What kind of Herx reactions do you typically see with this protocol in your practice? How to reduce, and do you recommend backing off or pushing through if they occur? All right. So, my protocol one of the recommendations I have in my article called Kills Bartonella Brief Guide, you can find it in my book, which is right back there, or you can find it at my Lyme information website, Treat Lyme by Marty Ross MD. Same article shows up in both places. It's called Kills Bartonella Brief Guide. One of the options I give for treating Bartonella is to use the azithromycin along with fluconazole. And then as a means of strengthening the 2 things. One is strengthening the treatment of persister Bartonella and removing Bartonella biofilm, and also treating growing Bartonella. I also suggest using Liposomal Cinnamon Clove Oregano. Now, if you cannot use the cinnamon clove oregano, a decent substitute is the Japanese knotweed. I agree with that, because Japanese knotweed, also based on research that came out of Johns Hopkins a couple of years ago now, has the ability to treat growing and persister Bartonella, and it can also break apart I can treat growing and persister Bartonella. The only deficiency you have, though, if you do that, is you no longer are on an agent that would be good at removing biofilm. All right. And so the other thing you might want to substitute in, if you can't do the cinnamon clove oregano, is to use a product by Research Nutritionals, which is called BioDisrupt. It has in it a number of enzymes, and although it's got some oregano in it, you'd have to see if you can tolerate it, but it's got a number of enzymes in it that can break apart biofilm. All right. And there's some good research showing it's active against Borrelia biofilm. No one's looked to see if it's active against Bartonella biofilm. If the oregano that's in there, and it's a small amount, would bother you and you couldn't do that, then another thing to consider, instead of the BioDisrupt, which you would do, the BioDisrupt you would take as 2 pills twice a day. The other option would be to look at just using the enzyme called Lumbrokinase, and that would be to take it as 1 pill 2 times a day. And wait a minute here. Yeah. Okay. All right. Then now the Lumbrokinase you would need to take on an empty stomach. That's the only problem. Okay. And by that, I mean, you cannot take it with, I usually advise people to stop medicine and supplements 1 hour before they take it, and they can resume them 1 hour after. And that stands for food as well, too. Okay. On the Lumbrokinase. BioDisrupt, it doesn't matter as much. Okay. All right. In terms of timing of things, you could actually take your fluconazole azithromycin at the same time that you take your the Japanese knotweed. You could do that in the morning with it if you want to, or the way you're proposing to do this, with your probiotics is, well, I wouldn't take it with your probiotics because the azithromycin is going to have a better chance of killing your probiotics. All right. So what I would suggest doing is do your Japanese knotweed morning and night, and then either in the morning or in the night, also do your azithromycin fluconazole. And then in the middle of the day, well, yeah, probably in the middle of the day, because even the Japanese knotweed, even though it's not a traditional antibiotic, may also interfere with some of that probiotic effect. Okay, so somewhere in the middle of the day would be a good time to wind up taking the probiotic as well too. Okay, all right. And then, it depends on who you are. I mean, if you're a person that tends to have strong herxes, I probably would start your azithromycin fluconazole first. And as you see how you're tolerating that, then add in the Japanese knotweed. And the Japanese knotweed, I probably started at, you might start about 10 drops twice a day and add 1 drop per dose per day to each dose until you get 30 drops twice a day. And as you're going up on that, if you herx, don't advance it until it passes. Once you're stable on that, then add in your enzyme or your BioDisrupt. Okay, so kind of stage it. Start with your azithromycin fluconazole first. As you know you're tolerating that, then come back and add in your Japanese knotweed. And then as you know you're tolerating that, then add in either the BioDisrupt or the Lumbrokinase. Okay, all right. So let me just do a quick screen share here for you. Well, this is going to look a little weird here. Just bear with me here a minute. There we go. All right. All right. So in terms of the products that I was talking about, this is my supplement store, Marty Ross MD Supplements. If you're trying to see what products I recommend, which ones I have found useful in my practice, which ones I have found to be full of the ingredients they say that they are, I've curated a whole site of supplements here for you based on what I see works in or saw worked in my practice in Seattle, but also based on the manufacturers and the quality that they put into their products. Okay, anyone can buy from me. I just want to make you aware of that. All right. All right. So, and the reasons to buy from me are, number one, I sell my products at the lowest amount allowed by the manufacturer. Number two, if you should happen to have taxes, I cover for those taxes. And number three, we have free shipping if it's $50 or more. And number four, we ship fast. If you order your products before 2 p.m. Monday to Friday, we ship it out the same day. Okay, we ship it to USPS, and then USPS may take some time getting it to you, but we get it to you USPS that same day as long as you order before 2 p.m. Monday to Friday. Okay, all right. So anyhow, BioDisrupt. It's a research nutritionals product. And just want to show you here. So it's got some serrapeptidase, beta-glucase, lipase, protease, cellulase, hemicellulase. It's got some rosemary leaf and a little bit of peppermint oil powder. So I'm not sure, given that you've got some problem with the cinnamon clove oregano, whether you would have problem with other oils, but those are the two that you may need to think about with that. Okay. All right. And then in terms of everyone, Lumbrokinase products that I recommend, there's actually two options that I carry here. One is Lumbrokinase by Allergy Research, and then there's another Lumbrokinase that's made by a company called Canada RNA, and they call their product Baluki. The difference between these two products is cost. Lumbrokinase per pill is cheaper than the Baluki. But the Baluki is a 20 milligram pill and the Allergy Research is a 16 milligram pill. In my practice, I really didn't see a difference. If somebody took one pill twice a day of Lumbrokinase by Allergy Research or one pill twice a day of the Baluki, I didn't see a difference in how they affected a person. Okay. All right. And then finally, for those of you that are not aware of what I was just talking about, if you want to know how to treat certain infections, look in my infection treatment plans section here. And there is an article down here called Kills Bartonella, a Brief Guide. If you're also looking to see the best herbal antibiotic options, I include herbal options in my Lyme disease antibiotic guide. I include them in a Kills Bartonella Brief Guide. I also include them in Kills Babesia Brief Guide, but I came up with a more extensive list of options in an article I released earlier this week, which is called The Best Herbal Antibiotic Plans for Lyme, Bartonella, and Babesia. So you could also take a look at that as well. Okay? All right. All right, John. Thanks for the question. Good luck to you. Hello, Tyler. Let's see. What lives in the skin and causes a low-level burning sensation, almost like windburn or a mild sunburn? When I cross-reference symptoms, it matches up more with syphilis or Morgellons more than anything. Have you ever used your herbs combined with DMSO topically in order to get it into the microcirculation? So typically, a burning sensation in the skin usually is due to injury of the nerves, actually. Nerve injury gives burning sensation in the skin. And it can be caused by nerve injury from either Borrelia or Bartonella. And basically using the oral antibiotics, either herbal antibiotics or prescription antibiotics, will get at it. I don't find benefit in putting topical antibiotics on them using DMSO or not to get better penetration at the skin level, but going systemically by taking them in a pill or oral form will get them to circulate to those injured nerves. Okay? All right. Good luck to you, Tyler. Hello, Ala. Let's see. Hi, Dr. Ross. I hope your family is in good health. Thank you. They're getting there. I've had a journey here lately, everyone. My mother passed away in January. My father immediately at 93 decided to have a stroke and a heart attack. And then about 2 months ago, one of my two dogs went into acute liver failure and almost was in a coma, almost died. He came through. But 3 weeks ago, I had to put my other Basenji down. So we're having a kind of a complicated period here. So anyhow, at this point, though, Dad seems to be thriving again, and Thor has got an active, vital life. So, and I'm coming through all of this. So thank you for saying that, though. Let's see. Should fiber be avoided during antibiotics? I am on rifampin and azithromycin for Bartonella, and would like to maximize bioavailability, minimize inhibition. So fiber is not going to limit the absorption or usefulness of azithromycin or rifampin. I see no reason you can't be on fiber. Okay? All right. Thanks for our question. Hello, Zainab. Let's see. Hi, Marty. Thanks for always answering my questions. You're welcome. You can pronounce my name. Oh, there you go. You're telling me. Thank you. Zainab for future reference. I hope I said that correctly. I hope that Z-A-Y is Zay. Okay, so Zainab. I really appreciate your sessions today. And thank you for telling me how to pronounce it, too. I hope I'm not chewing it up too bad still. Let's see. I really appreciate your sessions. Today, I'd like to ask, how long do you generally keep a patient on lumbrokinase for? Are there any signs you look out for when deciding to end the lumbrokinase? So, I use lumbrokinase for a number of reasons, but primarily these days, I'm using it in the case of Bartonella and also in the case of Babesia to help break apart fibrin germ nest. Okay, so both Bartonella and Babesia have the ability to wrap themselves in fibrin. And once they get wrapped in this blood clotting protein called fibrin, they then stick themselves on blood vessel walls and they kind of hide away from the immune system and antibiotics. So you want to do something to break that down, okay? So as long as you're treating with antibiotics your Bartonella or Babesia, I would stay on it, okay? And then when you get to the point you can stop those antibiotics, herbal or prescription, then you can stop the lumbrokinase, all right? Likewise, another reason you can use lumbrokinase in tick-borne infections is it can help break down biofilms, which are different than fibrin nest, okay? Biofilms are mucus slime layers that have multiple germs living in them, and then have a protein skeleton made up of fibrin that kind of holds the big glob together, basically, all right? And lumbrokinase, in theory, will help break apart those biofilms by breaking down the fibrin skeleton nest, basically. Okay? All right. Thanks for your question, Zainab. Or Zainab. There you go. Hello, Jamie. Let's see. Does the immune system get downregulated? I feel like my body's no longer fighting these infections as a primary invader. I'm not running fever. It just turns into wasting disease. Also, what happened to the Gemsic clinic? It appears it closed down with no disclosure. I don't know the full details about Gemsic other than he had an acute health problem and wound up in the hospital. I do not know anything more than that, but he was ill enough that the family decided to shut down the clinic, basically. All right. So and it was sudden. I'm not sure what the nature of the medical problem was, but that was something that went out in a letter to his patients announcing that, basically. So in terms of downregulate, so not in everyone, but in some people with tick-borne infections, there is immune suppression that happens. The Borrelia itself releases multiple kinds of chemicals that can turn down, suppress the immune system. Likely Bartonella and Babesia can do it as well too. The other thing that happens when you have chronic infection in you, the immune system, and trying to get rid of these germs, white blood cells are manufacturing, let me see here. White blood cells are manufacturing cytokines, and these cytokines are good and bad. On the good side, they turn the immune system on, they cause more white blood cells to be made, and they draw those white blood cells to where the infection is, okay? But on the negative side, too many cytokines suppress the immune system, all right? So you kind of got a cat and dog game here. So basically, hopefully, as you're killing your germs and you work with anti-cytokine supplements like glutathione, like curcumin, you eventually can get some of that, the cytokines down, which then will allow the immune system to work better, all right? That's what the goal is, basically. So the things I like to use to lower cytokines as part of your treatment, you can see them in my Ross Lyme support protocol, but I recommend usually working with liposomal curcumin. The product I'd like for that is a product by Thorne called curcumin phytosome, and it is a 500 milligram pill that people should take 3 times a day. And the other thing I like to couple that with is liposomal glutathione. I like using a liposomal variety of both glutathione and curcumin because on their own, they're just not well absorbed, okay? But if you microscopically wrap them in fat, you can increase, excuse me, I got something hanging on the side here. If you microscopically wrap them in fat, then you can get better absorption of them. So the product I like that has good absorption data for the glutathione is a product by Research Nutritionals called Trifortify. And again, the curcumin is curcumin phytosome by Thorne. Okay, all right. And if you do the Trifortify glutathione, it is, I think it's 550 milligrams per teaspoon, but I usually recommend 1 teaspoon per day on that one as well too. Okay, all right. Thanks for your question, Jamie. Let's do a screen share here again. All right, so in terms of, I mentioned earlier my Lyme protocol, the Ross Lyme support protocol. And in here, I have essential steps that you should go through, like getting sleep, the diet I recommend, what to do about cytokines. I just give you the basic steps that you should work on in your Lyme treatment. and I give initial recommendations. So in my cytokine control section here, I talk about what cytokines are, but then I tell you some things that I suggest starting with to control it. And initially it's curcumin, but if that doesn't work, then I also recommend taking further steps, okay? And you can read about those further steps in my article called Control Cytokines, A Guide to Fixing Lyme and the Immune System. And in here, I talk more specifically about what cytokines are, how they work, and the steps you can use, all right? So one step is get sleep, take the curcumin. The next step is add in liposomal glutathione, okay? All right. And then in terms of the products I recommend for that, again, for the curcumin, so take this curcumin phytosome by Thorne. And then for the glutathione, I like any of these Trifortify products by Research Nutritionals. And again, the reason I recommend the Research Nutritionals product is actually have data proving that they have good absorption of their product, okay? All right. Let's see here. Hello, Maria. Let's see. Hi. Based on symptoms and testing, I believe I have Lyme, Bartonella, and Babesia, possibly Epstein-Barr, and have been treating for about 1.5 years now. I recently tried adding Arterosil. Even at low dose, I get notably increased fatigue and all over low-grade swelling. Our effects are worse at higher dose. Do you have any thoughts on why it is causing these symptoms? Also, I am wondering if you have thoughts on taking L-arginine for Babesia while I have high IgG antibodies for Epstein-Barr. I also did an agalase test and those numbers were within normal range. Thank you. All right. So, I'm not quite sure why the Arterosil is making you worse other than, bear with me here. So the Arterosil, one of the ways I recommend people start taking it is 2 pills twice a day. I think on the bottle they recommend 1 pill twice a day. Presumably, as you start, so the Arterosil is used to repair what is known as the endothelial glycocalyx, which is a lining inside of blood vessels, right? So you've got blood flow, and you've got this thing called the endothelial glycocalyx, which covers the endothelium, which are the cells of your blood vessel, and the endothelium sits inside the muscle of the blood vessels, basically. Okay, all right. And the endothelial glycocalyx is basically kind of a mucous membrane that has a bunch of small hair fibers that stick up from it. The action of blood flow going over these hair fibers causes them to get moved. And when they get moved within the endothelial glycocalyx, there is a production of nitric oxide. Nitric oxide gets into the bloodstream and then causes dilation of your blood vessels. All right. The other thing that happens when you get repair of the endothelial glycocalyx, you get less blood clotting, you get less stickiness of the blood, so you get better blood flow as well too. All right. So ultimately what Arterosil does is it leads to better blood flow. And if you're on antibiotics, you may be getting quite an increase in killing as a result of the improved blood flow from the Arterosil. So what you might want to do is cut back to 1 pill every other day. And as your body adapts to that, go to 1 pill every day, and then see if you can work up to the 2 pills twice a day. Okay. You may or may not be able to, but I would give that a try. When I'm wondering, knowing how it works, I'm wondering about some kind of a Herx reaction, basically. Okay. Keep in mind also that anything can happen to anyone with anything. And another likelihood is you may just be having bad side effects to this. I would not call these common side effects, but that may be what's happening with you as well too. But I'm more inclined to think this is likely some kind of part of a killing reaction because you got better blood flow. Okay, all right. Let's see. I don't have any thoughts on taking L-arginine for Babesia. I mean, in theory, it's going to lead to better vasodilation, which you're already getting from the Arterosil. So I'm not sure if you need to do that. Yeah, anyhow, I hope that gives you some things to work with there. All right. Good luck, Maria. So everyone, we know in COVID that one of the things that happens in COVID and in long COVID is that there is lab evidence that this endothelial glycocalyx gets injured. And one of the reasons it does get injured is COVID, the way that it got into our cells, it bound to these things called ACE2 receptors. And the endothelial glycocalyx is rich in ACE2 receptors. So one of the ways that there was injury that occurred to various tissues in the body from long COVID or from COVID in general is that it damaged the endothelial glycocalyx, which then resulted in less nitric oxide production and resulted in these microclots forming that some people with long COVID have, and that decreased blood flow to the tissues, and you got organ injury, basically. All right. So in long COVID, one of the things we advocate is using the Arterosil to help with that. And in fact, I built Arterosil into my long COVID protocol. All right. More recently, though, I've also been advocating giving it a try for Bartonella. Now, I will tell you, there is no research proving there is injury to the endothelial glycocalyx that happens in Bartonella. But the reason I'm advocating for it is with Bartonella infects those endothelial cells that line your blood vessels. And if they get injured, there's a good chance that the endothelial glycocalyx that covers them gets injured as well, too. So I've been advocating for it. But to be clear, no one has done research looking at does fixing the endothelial glycocalyx make any difference for people living with Bartonella? We just don't know. We don't have the research. No one's looked to even see if it gets damaged. Okay. All right. Hello. Oh, and let's see. I know you're not a big proponent of antiparasitics, but it just seems like anecdotally, a lot of people around me are getting benefit from fenbendazole and topical oral ivermectin kettle wash. Some of these folks are 20-plus Lyme veterans, so not whimsical placebo sufferers. What's your experience? So I know that so to be clear, there are no studies that show that ivermectin kills Borrelia. All right. So some people use ivermectin to kill Borrelia. I want to be clear about that. All right. And then there are some theories that some people have based on some limited research that one of the reason that people with Lyme and tick-borne infections don't get well is they also have parasites within their body that are keeping them ill as well, too. All right. Now, I do believe in intestinal parasites. I think you can see them. There's lab evidence they can be there. Sometimes we're not great at testing for them. We can look at, did somebody get sick after they went to a trip in Mexico and they had diarrhea and they never recovered? Well, that might mean they picked up intestinal parasites there, even if their testing is negative. But I have never been a big proponent of the idea that people with chronic Lyme also are all infected with parasites in their system. And I think that's what you're alluding to. And the thing is, I don't think the science says that's true. Okay. All right. So just to be clear about that. All right. Now, one of the reasons that people may feel better on ivermectin, especially though, is it has strong immune modulation properties. It can regulate cytokines. And even if you look at some of the research that was done on COVID and long COVID, the authors of many of those articles and the proponents of using ivermectin also acknowledged that one of the reasons people may feel better on ivermectin may not have anything to do with germ killing, but rather its cytokine regulation abilities. All right. So it is possible people on ivermectin are feeling better, not from any germ killing, but rather from immune modulation of cytokines. Fenbendazole likely can, as any antibiotic can, may do some regulation of cytokines as well, separate from killing effect. So I can't deny that people are feeling better on it. What I'm proposing, it may not have anything to do with killing germs. It may have to do with immune modulation and changing the output and downregulating the production of cytokines. Okay. All right. Good luck to you all. Bunch of people asking if the webinar started. I guess I got going a little bit. People were ready to go when I first got here tonight. All right. Hello, Laura. Let's see. Thank you for all you do to help Lyme patients. My daughter has floaters in her eyes. Might that be a symptom of Borrelia or possibly Bartonella? You know, there's a number of people that report increased floaters with Borrelia is what I tend to see. Maybe it is part of Bartonella, but it can be part of the infection state. Often what I find is as you treat and get the germ load down, those floaters will start going away. Okay. Thanks, Laura. Good luck to your daughter. Hello, Bob. Let's see. What would you say to someone suspected of having Lyme and Babesia test come back negative one time, positive the next, and vice versa? So part of it depends. Well, first of all, it depends on which test you're doing, all right, and which lab is doing it. So as many of you know, I don't trust the validity of vibrant labs because they've never done the basic studies to prove their tests are accurate, all right? If these tests are being done by IGeneX, or they are being done by Infecto Lab, or they're being done by Armin Labs, or they're being done by T Labs, yeah, I trust the validity of what you're seeing. Okay, so I just want to make that clear. I do not trust the validity of DNA connections either. So if your testing is being done through a quality lab, and even the test results, if you're getting these test results from a PAC lab or the standard labs that you would go to the hospital and get done, your physician, instead of specialty labs, they're using FDA approved test kits. And as part of getting FDA approval, they had to test that their test is accurate. When it comes back positive, it means something. Okay. Right. But having said that, when you treat Babesia and Bartonella, or when you make a diagnosis of Babesia or Borrelia, I should say, Lyme, your diagnosis is looking at a few things. It's not based on any one thing. All right. Number one, we look and see, is there a risk you could have gotten it? And your highest risk of getting these is through a tick bite. Okay. So if you had a known tick bite, that's a high risk. If you had a known tick bite in areas where there happens to be a lot of tick-borne infections, like on the East Coast and the upper Midwest, Minnesota, and Wisconsin, Northern California, then you've got a high risk of having picked up tick-borne infection, all right? Also, if you happen to live in some of those areas and you're a person that does a lot of outdoor activities like a hunter, boaters, etc., you've got potential, you got a bite, you didn't even know it, and you might have gotten it. So we look at what are your risks. The highest risk is somebody had a tick bite. Okay. Number two, we look and see, what do your symptoms tell us? Do you have a lot of symptoms that look like Borrelia? Do you have a lot of symptoms that look like Babesia? And we can kind of make a distinction between what those two infections look like based on certain things. All right. Number three, we look and see, do you have any physical exam findings? So for instance, a finding that might indicate Babesia is having a bunch of little red marks. There would be like a whole crops of them. They're little burst red blood vessels under your skin, and they come up in big burst all of a sudden. You'll see that sometimes in Babesia, for instance, and that could be a physical manifestation of Babesia. And then number four, we look and see, are there any tests that support the diagnosis? All right. So the way that the immune system works in being able to react either with antibodies or in a T cell reaction test, its ability to react is only as good as whether it's not suppressed or not. And so you can have suppression that comes and goes. So sometimes you'll have positive tests, sometimes you won't. When somebody has a history of tests that come and go positive, I only need one positive test to say there's some lab evidence that they have that infection. Okay. So I would say if you have enough symptoms that look like the illness and you had a positive test at some time, and if you're still not doing well, then you probably have one or both of those infections. All right. Good luck to you, Bob. Let's do a quick screen share here too. All right. So in terms of looking to see if you have an infection and what the symptoms are of the various infections, take a look at my section here called How to Diagnose. And within the How to Diagnose Bartonella, I list out symptoms that make us think more about Bartonella. And How to Diagnose Chronic Lyme Disease, I talk specifically about symptoms that we find as on something called the Horowitz MSIDS questionnaire, okay? And then Babesia, there are specific symptoms that we consider, and you can read them in this article here as well too, all right? All right. All right. Hello, Susan. Let's see. My daughter's had overnight hearing loss in one ear, belief that it's involving eighth cranial nerve. She had neurologic Lyme. What are your thoughts? Thank you. So, hearing loss could be from nerve involvement. It could also mean that she had a big air pocket develop behind her eardrum, or she had fluid that temporarily developed behind her eardrum. So it's hard for me to say whether the hearing loss is a sign of having tick-borne infection or not. I can't tell. This is the kind of situation where you need to get that ear looked at and see, is there another possible reason to explain hearing loss other than a neurologic problem. If after getting the ear looked at, they have some suspicion it's neurologic, then yeah, that could be part of neurologic Lyme or neurologic Bartonella as well too, okay? But you can't just presume if somebody has Borrelia or if they have Bartonella and they develop neurologic hearing loss that it or hearing loss, that it automatically means neurobartonella or neuroborrelia. We have to be careful in the world of tick-borne infections that we always don't put our blinders on and see everything as being Bartonella and Borrelia or Babesia or other tick-borne infections, because other things occur too, okay? All right. Good luck, Susan. Hello, Thomas. Let's see. We are treating Borrelia with ceftonir, minocycline, Japanese knotweed, and cryptolepis. Does this combo address all forms? So the answer is yes, and it also addresses all growth states again. So the ceftonir is picking up spirochete Lyme. The minocycline is picking up intracellular and spirochete Lyme, and both of those are picking up the growing state of spirochetes, okay? The knotweed and cryptolepis are likely picking up spirochete, intracellular, and cyst Lyme in both growing and persister states as well too. So yes, you've done everything there, okay? All right. Hello, Catherine. Hi, Dr. Ross. I don't have access to an LMD, so I have to do my own research for treatment. What lab work should I do on a regular basis? Well, if it depends what you're taking. If you are doing this all with herbal antibiotics, I would suggest getting a blood count, CBC blood count, and something called a CMP or comprehensive metabolic profile that looks at kidney and liver function about every 3 months. All right. If you are on prescription antibiotics, it all depends on which prescription antibiotics you're on. So if you are on fluconazole, for instance, that we can use for Bartonella or to treat yeast, and you're going to be on it for more than a month, I usually at the end of a month will check and see what the liver functions look like. And then if that looks good, I might not check again for another 2 months. If you are on Bactrim, which is a sulfa antibiotic, or the tetracyclines, I definitely want to get a blood test about a month after you start those. And what I'm looking for is make sure your kidneys are holding up okay by looking at a BUN and creatinine level. And if they are, then I would come back and look again in 2 more months. All right. So roughly every 3 months with a CBC and something called a CMP that looks at kidney liver function. But depending on what else you're on, I might do it more regularly to begin with. Okay. All right. Good luck, Catherine. Hello, Bob. Let's see. In a previous webinar, you said that whenever treatment path we choose, we have to be on it for a year. Should expect some improvement before then. So in terms of what we know, and I've got an article I'll show you about this here in a minute, where I wrote this all down too. Okay. So when it comes to Borrelia, studies tell us that when you have chronic Borrelia, on average, it's 1 to 2 years to get well. All right. For the majority of people. All right. 1 to 2 years. With Borrelia, though, there are studies that give us an idea how quickly you'll start turning the corner. So there's a laboratory experiment that was done. It wasn't published, but it was presented at one of the ILAS meetings a number of years ago. And in the laboratory experiment, what the researchers did is they put everyone with Borrelia on clarithromycin as well as Flagyl. All right. So in that protocol, that we didn't know about persisters then, right? But on that protocol, the clarithromycin would have treated intracellular spirochete Lyme, and the Flagyl would have treated the cyst form of Lyme. And they watched to see how quickly people start having some benefits. And what they found is that by 3 months, 30% of people started doing better. By 6 months, 60% of people started doing better. And by 9 months, 90% of people started doing better. All right. So what that means is it takes time. So only 30% start showing any improvement by 3 months, only 60% by 6 months, and by 9 months, 90% start having some improvements. All right. All right. Then if we look at Bartonella, on average, treating Bartonella for about 85% of people is a 4 to 6 month treatment. There are 15% of people that just do not improve in that time frame, and it winds up becoming a number of years to get them well sometimes. Okay. But for 85% of people, Bartonella can be treated with standard protocols that I write about, and 85% of people will get well in a 4 to 6 month period. Now, when you are on a Bartonella protocol that is working, and it's a prescription antibiotic protocol, usually within 1 to 2 months, you'll start having some relief of some of the Bartonella symptoms, not the Lyme symptoms, but the Bartonella symptoms. And if you're wondering what those Bartonella symptoms are, look at the article that I mentioned earlier. Okay. All right. All right. Then when it comes to Babesia, we usually want to, for about 80 to 85% of people, Babesia is easily treated with 4 to 5 months of antimicrobials. That 15% of people require longer, but 80 to 85%, it'll be handled in that time frame. And generally, if you're on the right Babesia treatment, you'll start seeing improvements within about 2 months. Okay. All right. With your Babesia symptoms, look at my How to Diagnose Babesia to see what those Babesia symptoms are. Okay. All right. I showed you both those articles earlier. All right. Now, herbal approaches to Bartonella and herbal approaches to Babesia sometimes will take about 3 months before you start seeing some improvements if they're the right choice. Okay. All right. Good luck. Oh, let me show you an article on that. All right. So let's see, where do I put this here? So there's a section here called Recovery Time and Odds. And this article called When Will I Start to Feel Better? Okay. I discuss the various timelines and how long it's going to take. All right. Good luck to you, Bob. All right. Hold on, everybody. I forgot to bring a glass of water here, and I am really feeling thirsty. I just worked out right before we started the webinar, so it's catching up. Give me just a second. All right. Sorry about that. Hello, Dan. Let's see what you got here. Let's see. Have a question. Persistent neurologic symptoms such as muscle twitching or fasciculation 8 months after initial infection. Does this represent neurologic damage left over from initial infection, or is this still possibly active disease? All right. So if you've got a lot of muscle twisting and fasciculations and it has not really improved much, unless this has been done already, I would consider seeing a neurologist to get something called nerve conduction studies done. At times, not with everyone, but some people, their muscle twitching is a sign that they have Lou Gehrig's or ALS, okay? And they can tell by doing something called a nerve conduction study to see if that's what's happening with you or not, all right? So if you have not had that done, at least I would go ahead and do that, all right? Then, in terms of if those symptoms are persisting, but all of your other symptoms got better, then it could be that you have damage to the nerves, and that's why you're having this problem. On the other hand, if the rest of your Bartonella or Borrelia symptoms have not improved at the same time the fasciculations have not improved, that means you need to still keep treating and keep working on finding an antibiotic regimen that will work for you. And that means herbal or prescription antibiotic regimen as well, too. All right. The other thing, if you've got so if you have been treating for 8 months, and I can't tell whether you're using antibiotics or not, if you're treating for 8 months with a decent regimen that actually addresses whether it's Bartonella or Borrelia, whatever the infection is, and you're not getting better, you might also want to start taking some steps to do nerve repair, which I usually would have people add in maybe about 6 months to 9 months in. And those steps to do nerve repair include trying to get the inflammation of the nerves down using curcumin. Second thing is to use glutathione, and I like that liposomal glutathione I showed you all earlier. That's the Trifortipride product, 1 teaspoon a day. That will help repair nerves from the inside. It also helps repair the energy factories found in our nerves called mitochondria from the inside as well, too. Okay. All right. And you would want to do that as 1 teaspoon 1 time a day. The other thing you want to do is repair the nerve membrane as well as the mitochondria energy factory membranes as well. And what does that is to work with phospholipid fats. The product I like that is full of those phospholipid fats and other factors that help your mitochondria and nerves work better is a product called ATP 360 by Research Nutritionals. And I would suggest taking 3 pills of that 1 time a day. All right. And then finally, if you want to go the full court press, you could add in a peptide, which is called BPC 157. BPC 157 is a peptide that is made naturally in our stomach lining. Its purpose is to help keep your gut working correctly and repair damage further downstream in the gut. But in addition, BPC 157 can repair injured joints, injured muscles and tendons, and can do neurologic repair as well too. And so you could take one pill twice a day of that as well too. Okay, all right. So let me just show you an article about how to do nerve repair. But if you didn't get any treatment for tick-borne infections, you need to go looking and see what you have and start treatment for those as well too. Okay, all right. Let me see here. All right, so take a look here and look in my brain and nerve section. And there's an article here called Peripheral Neuropathy Evaluation and Repair in Lyme Disease. And I talk about, doing a basic laboratory evaluation. I talked to you about that up here. I talk about removing the insult to your nerves, which means treating infections if that's the cause, and then taking steps to repair the nerves, okay? And in terms of doing the nerve repair, you want to fix the nerve membrane, the mitochondria. That's what I was just mentioning with that ATP 360 and glutathione. You want to decrease nerve inflammation with this curcumin that I was telling you about. And then finally, the BPC157 is a peptide that can help with nerve repair as well too. Okay, all right. And again, all of those you can find at my supplement store if you're looking for a source for those as well too. All right. Good luck to you, Dan. Hello, Lee. Hold on here just a minute. Let's see. I was diagnosed with Lyme in 2020. Since then, I have had 3 additional blood tests that confirm positive serology for Lyme and Lyme co-infections. My primary care doctor for over 20 years recently retired. I had to find a new PCP. On my first visit, I wanted to review my blood tests and treatment protocol. He was less than interested. He then informed me that nearly 100% of Lyme patients are fully cured. Really? I informed him the CDC recently changed their position on chronic Lyme. He was totally unaware. I think we seem to ignore the question, why do the majority of medical professions ignore chronic Lyme? Until we answer that question, average folks on Medicare will be ignored by the profession. Why do you think this is the situation? Oh boy. Lee, that's a whole, the politics of Lyme disease is one of the most screwed up things that I have ever seen. If you're looking for a person that did a lot of investigating as to how did we get to this point that physicians are so ignorant about this illness, it's not a simple answer, okay? It's a complicated answer. I would take a look at a book by Pamela Weintraub. Her name is spelled Weintraub. It's Pamela, and the book is called Cure Unknown. And she reviews the history of how we got to this polarized state where doctors still deny the existence of chronic Lyme. What is interesting now, I will tell you, even though the medical professional societies like the Infectious Disease Society of America and the American Neurology Association, those groups are still steadfast against the idea that people can have chronic infection, I think the tide is changing. And I think that a lot of primary care doctors now are more open to the idea. They may not know how to treat it, but they're at least becoming more open to the idea. We have seen a shift in what is going on out there with primary care docs. The specialists still are a mess right now, but I would take a look at that book. It's not an easy answer on it. It's politics. It is drug company money. It is some of the major leaders in the field initially got money helping insurance company, et cetera, et cetera. Okay, so take a look. You'll see where it is. Okay, so Pamela Weintraub, cure unknown. Thanks for your question, Lee. Hello, Gene. Let's see. Our son, 45, has had untreated or improperly treated Lyme for decades. It has progressed so far that it has seriously affected his mental health. Is it too late for treatment? He's on antipsychotic meds now. It's not too late for treatment. It'll be harder to treat, but it's not too late for treatment. I've seen people with, on average, if you've had it longer, it does take longer to get over. Having said that, I once had a person that came to see me in my practice that probably had Lyme for a good 30 years. He didn't have mental illness with it, but he was terribly debilitated, body pain, fatigue, a lot of cognitive decline, thinking decline. And I would have thought it would take a good 2 years or more to treat him. Within 4 months of being on antibiotics, he was almost 100% well. All right. Now that's a rare person, but it can happen. All right. So I am sure it's scary to see this with your son, but I won't let you know. Yeah, he could get full recovery or near full recovery still, even at this point. Okay. All right. Good luck, Gene. Hi, Deborah. Doctor suggested I have mold in the brain. My lab numbers were good for the organisms Lyme, Bartonella, and Babesia. So I want to clarify what the word mold in the brain means. Okay, so within the world of tick-borne infections and chronic fatiguing illnesses, we also recognize that there are a group of people that may be debilitated because they have mold toxins in their brain, not mold infection in their brain. Okay. So I haven't seen anyone with mold infection in their brain, but you can have mold toxins throughout the body that give you a lot of neurologic dysfunction cognitively as well too. So we know, based on science of a physician named Richie Shoemaker, that approximately 25% of all people have a genetic programming profile that makes it so that when they breathe in a mold toxin from the world around them, they are not able to get rid of it. Okay. What happens in 75% of people is we breathe in mold toxins that we get exposed to in wet buildings or in the environment. And we breathe them in, they get into our bloodstream, and our immune system will make antibodies that will grab onto these toxins and break them down and deactivate them. All right. That happens in 75% of people. There are 25% of people, however, that their immune systems don't make the antibodies. And so there's nothing to break down the mold toxins. The next step that is supposed to deal with mold toxicity or any toxins that are fat-based is our liver is supposed to step in and clean out these toxins. But the liver doesn't handle these right either. They get moved to the gallbladder. They're still a fat-based mold toxin. They go out into the intestines. And within the intestines, rather than getting pooped out, they get reabsorbed back into the bloodstream again. Okay. So you get this endless loop. And having mold toxins in you can look just like Borrelia and Bartonella, for instance. Okay. And the reason they can look very similar is both the infections as well as mold toxicity triggers your immune system to make too many inflammation chemicals called cytokines. All right. And so those excess cytokines then give you manifest most of the problems we have in these illnesses. So too many cytokines make it so you can't sleep, can give you mental health disorders, make it so you can't think, give you severe fatigue, interfere with how your hormonal systems work, make you hurt all over, et cetera, et cetera. All right. So mold toxicity trigger cytokines, Borrelia, Bartonella, Babesia trigger cytokines. They all can look the same. So to see if you might have mold toxicity, we usually advocate that people do a urine test through a lab called Real Time Labs. if you have high amounts of mold toxins in your blood, you will pee some of those out, and you'll be able to tell whether you've got excess amounts or not. Okay. So I hope your doctor talked to you about how to look for that. Okay. All right. Good luck to you, Deborah. So, Deborah, if you happen to have mold toxins in you, you're asking what would get mold out of the brain. The things that get mold toxins out is you have to bind them up in the intestines. And we use what are called binders. And which binders we use depend on which mold toxins you have in you. Okay. All right. So if you want to read a little bit more about this, I'm going to do a screen share here for you. All right. Oops, what am I doing here? Here we go. So take a look at my detoxification section here and take a look at this article called Mold and Lyme Toxin Illness. All right. And down here, I talk about the urine mold toxin test. I talk about binders that you can use as well too in this section. Okay. All right. Good luck to you, Deborah. Jean, thank you for your condolences on my mom. I appreciate that. So Deborah says, what do you think of guaifenesin and NAC for foggy brain? I don't think the guaifenesin helps. Brain fog is often due to too many cytokines in the brain, okay, those inflammation chemicals I mentioned earlier. In addition, it can also be due to toxins that have built up in the brain too. So generally, there's two things I like looking at, or a few things I like looking at for brain fog. Number one, you want to do things to get whatever is triggering the brain fog under control. So if it's infections or mold toxins, deal with those, okay? Number two, you want to lower cytokines. And what I like to use for that is called curcumin phytosome, or curcumin 500 milligrams 3 times a day. I like the product by Thorne. I showed you all that earlier tonight. In addition, I have found it useful to use glutathione for two reasons. Number one, glutathione helps with detox to pull toxins out that might be partly giving you some of that. And in addition, glutathione as a strong antioxidant is able to decrease the signals that tell white blood cells to make cytokines, all right? So what tells white blood cells to make cytokines are oxidizing agents. And if you have excess oxidizing agents, that triggers from infection or from mold toxicity, that triggers the white blood cells to start producing cytokines. And so if you lower some of that with the glutathione, that can help. The way that curcumin lowers the cytokines is it actually gets inside the white blood cells and blocks the production line. It limits the production, all right? So glutathione blocks the signals that tell the white blood cells to make cytokines, and then curcumin gets inside the white blood cells and limits their production, okay? All right. Hello, Dina. Let's see. I tested positive for Bartonella and Babesia through Igenics. I'm taking cryptolepis and Japanese Knotweed. Do you think that is sufficient? So yeah, that's a nice combination. The one thing, so the cryptolepis is useful at treating growing and persister Bartonella. The knotweed also is good at treating growing and persister Bartonella. The cryptolepis is very strong against Babesia. Knotweed, I believe, has, hold on, I have to look this one up. So knotweed has, in theory, based on lab experiments, does have some activity against Babesia, but I don't find it to be that strong. And so you could look and see if just Cryptolepis by itself will be enough to deal with your Babesia. It often is. But if you wanted to be stronger at this point of going after the Babesia, what I would probably add in is artemisinin. So you could do a Japanese knotweed Cryptolepis artemisinin protocol as well too. All right. And then artemisinin would, if you have Borrelia, which you're not mentioning here, the artemisinin can help with Borrelia as well too. Let me show you what that protocol would look like. I'm going to show you, do a screen share here. All right, so take a look at what we're going to take a look at here. Take a look in my section called The Latest, and this article called Best Herbal Antibiotic Plans for Lyme, Bartonella, and Babesia. And I developed this based on the writing of Buhner and then also recent science, all right? And here's a table that comes from some of the recent science that tells us which things do what, all right? And so, for instance, it is true that Japanese knotweed can treat Babesia. It is not that strong of an agent, though, all right? And so down here, I've got some, all right, so all right, so Babesia, Bartonella treated at the same time. All right, I give you a second option, which is to add artemisinin in. So you would do the Cryptolepis, you would do the Japanese knotweed, and then you would add in artemisinin, and I talk with you about how to do it here, okay? All right, and I think I have to rephrase how I wrote that. I was trying to say that this is a Babesia alone or a Babesia with Bartonella at the same time treatment, but I don't think that's clear how I said that. I have to go back and look at that. Anyhow. All right. Good luck to you. Hello, Karina. Let's see. Hi, I'm struggling with a lot of health issues. My NK57 are extremely low. ELISA and Western blot are negative. My neck is stiff as hell since years now. Is it Lyme for sure? I don't know. So as I mentioned earlier, there's 4 things we consider, and I would need to hear more about your full story, whether you've got risk of getting Lyme. Did you have a tick bite? Are you in an area where ticks carry Lyme? I would want to know more about all of your symptoms, not just what you wrote here. I will tell you, ELISA and Western blot will miss Lyme when it's present about 35 to 40% of the time. So even though that testing was negative, that does not exclude having the tick-borne infections. All right. Take a look at, so to figure out how to diagnose Lyme, take a look at the article I showed you earlier. Let me do a screen share. I'll show you again in case you missed it. All right, so go to my section in my online Lyme guide called How to Diagnose, and look at this video article that I have here that will walk you through the steps that you need to consider, even if testing is negative. And I also talk to you about what is the best test that you can use to aid in the diagnosis, but a test does not make a diagnosis. You can have Lyme and even have negative testing, for instance. Okay. All right. Good luck to you. Hello, Michelle. Let's see. What other prescription antibiotics pairs well with clarithromycin for BART and Lyme treatment? So if you're looking for prescription, you could look at doing a fluconazole or another member of the same family called itraconazole. So fluconazole and itraconazole are called azoles. Azoles are what we traditionally use to treat yeast. But there is laboratory evidence showing that the azole family is useful at treating cyst Lyme. And in addition, research from a couple years ago showed that the azoles are effective at treating growing and persister Bartonella. Okay. The other thing I would do, I know you're looking for prescription antibiotics. The one thing you're missing here, though, even if you go with an azole, is that you need to be more effective at going after the persister state of Borrelia. So again, Lyme can be growing or hibernating called persisters. Same with Bartonella. If you go with an azole here, they've got solid lab evidence that shows the azole will deal with growing Bartonella and persisting Bartonella, but we don't have any evidence it's going to help with Lyme. Okay. Now the azoles are good at cyst Lyme as well too, but probably more in the growing state, not necessarily a persister state. So you might want to look at adding in the herb called Liposomal Cinnamon Clove Oregano, which is very useful at treating growing and persister Lyme and Bartonella. That's 1 capsule twice a day. The product I like recommending for that is something called Liposomal Cinnamon Clove Oregano Essentials by a company called Dr. Inspired Formulations. You can find it at my supplement store, but that might be one way to go. Okay. Another option that could be useful would be to do the clarithromycin along with a drug called rifampin. And that would be useful at treating growing Bartonella and also growing Borrelia and pick up all forms of the Borrelia Lyme. Okay. And again, you would still need to add something to that that's going to go after the persister state of both germs. And again, I would recommend the cinnamon clove oregano to do that. Okay. If you are looking, anyway, that's what I would suggest doing. Okay. All right. Good luck. Actually, let's do a quick screen share here again. There we go. All right. So in terms of this product I was telling you about, take a look at Dr. Inspired Formulations and the cinnamon clove oregano that I was describing that would help with both Lyme and Bartonella growing and persister forms is this liposomal cinnamon oregano essentials. Okay. All right. It's 1 pill twice a day. Hello, Elaine. Let's see. Hi, Dr. Ross. Does an accurate diagnosis require both an antibody test and Western blot test? My doctor is resistant to ordering a Western blot test, even though my possible Lyme exposure was 10 years ago. I have been on my functional medicine doctor's Lyme protocol for over a year with no improvement. Mole tests are negative. I am wondering if the Lyme diagnosis was wrong. So, again, I hope in terms of making a Lyme diagnosis, I hope you heard some of the answers I gave earlier. It's not all about a test. You can have negative testing and still have the Lyme diagnosis. If you missed the comments I made earlier, look at my article about how do you diagnose Lyme. Okay, so I just want you to know that. Okay. In terms of if you had a negative test initially, and now you're wanting to go back and test to see, is it still there? If you initially had a negative test and you want to look to see, do you have any laboratory evidence of having Lyme in you, I would recommend a different testing method than what you're looking at doing here. IGeneX has developed a newer testing technique that's now about 1.5 to 2 years old that is much better than the antibody test and the Western blot test, okay? And that test is a method called an immunoblot. And what IGeneX is doing with the immunoblot that makes it better than the antibody with or without Western blot test is they're looking to see if you have antibodies in your body against Borrelia, 8 different strains of Borrelia. The ELISA antibody test you're talking about, or the Western blot test that would be done through regular labs, is only looking to see if you have a reaction against the original East Coast strain, and that's from the 70s. There's a lot that's happened between now and the 70s, okay? So the IGeneX method is the best test out there to see if you might have antibodies that say that Lyme is either in you or was in you at some time. That would be to do the immunoblot method for Borrelia. You would get an IgM and IgG immunoblot that would give you the best chance of figuring out whether you actually have or had it, okay? I will also say there is no test that you can do that says you're done. Even if you had a negative test to begin with, and now you have a positive test, even if you had a positive test to begin with and now it's negative, but you still have symptoms, there's no test that proves the germ is out of you, unfortunately. Okay. All right. Now, the antibody test, the standard method that the Centers for Disease Control tells us to do is a screening antibody test called an ELISA. And then if that test comes back positive, then we're supposed to go and do a Western blot, which is what's known as a confirmatory test. The ELISA test, which is a screening method to see if you might have antibodies for Lyme in you, will miss Lyme if you have it in you about 50% of the time in chronic Lyme. And so therefore, most of us don't advocate using it, but standard doctors still do it, okay? The Western blot by itself will find Lyme if it's in you about 60% of the time. But again, it's going to miss a lot of cases too. So the best way is the immunoblot through IGeneX, which has a sensitivity, the ability to find Lyme if it's in you, of about 95%. Okay, much better than that 60%. Okay, all right. Good luck to you. Oh, I see. So yeah, so your vibrant okay, so vibrant in general. I see that you made a comment here. I'll show everyone your comment. So Elaine says that vibrant wellness tests were done. So in general, I don't like using vibrant because they haven't shown us that their testing technique is accurate. Okay, except their Borrelia test actually is valid. And has the ability to find Lyme if it's there about 65% of the time. But when it's positive, it really is positive. But again, it may miss it about 40 to 45% of the time. All right. And again, as I said, once you get a positive test, there is no testing we can do that says you're done. It doesn't exist. Okay. All right. Good luck to you. All right, we're going to take one more question. This is from Ida. Hi, thank you for all this great information. You're welcome. When I added Lumbrokinase for my daughter's Babesia, her air hunger got really bad. How can I proceed? Do I reduce the dose, eliminate it, or modify in some way? All right. So a Babesia Herxheimer reaction from killing Babesia can look like either increased fatigue, increased sweats, or air hunger. All right. So it's a killing reaction. If you're not doing things to limit cytokines that are involved in a Herxheimer killing reaction, the first step is add in curcumin, 500 milligrams 3 times a day would be an adult dose. I don't know how big your daughter is, okay, but adult dose for a 150-pound person, okay? And for a 150-pound person, I would do glutathione, a teaspoon a day. Now, let's say if your daughter is half an adult size, 75 pounds, then I would do 250 milligrams 3 times a day, or 500 milligrams twice a day of the curcumin. You could do it that way, and probably half a teaspoon once a day of the glutathione. All right. And once you get those on board, I would try adding the lumbrokinase again, but instead of doing it as 1 pill twice a day, I would start at 1 pill every other day. And as she adapts to that, then go to 1 pill a day. And eventually, as you can, work up to the 1 pill twice a day. Okay? All right. Good luck, Ida. Or Ida. I'm not sure how you say your name there. I'm sorry if I botched it up. All right, everyone. So that's it for me for tonight. So it's 7:32 here. I enjoyed being with you here tonight. I'm sorry I had to cancel last week. I was actually it took me longer to get back, driving back from Seattle in my camper van with Thor, my dog. We had been in Seattle scattering my Basenji's ashes, Halo. We decided to scatter her in her favorite dog park there. So I got road delayed, and so I just wasn't going to be in a good place to have the webinar. So for those of you that missed me last week, I apologize for that. It was good to be back this week, and I do look forward to being with you again next week. Tomorrow morning, take a look at your email somewhere around 9 to 9:30 a.m. Central Standard Time to see the email that I'll send out announcing that the recording is ready to be seen. And also, it'll have a synopsis of what we talked about. And then finally, you can you can sign up for next week's webinar as well too. All right. Good night, everyone. Good to see you tonight.